Hello, my name is Michael Fitzgerald. I'm one of the orthopedic upper extremity surgeons here at SOS. And today we're going to talk a little bit about carpal tunnel syndrome. Carpal tunnel syndrome is the compression of the median nerve at the wrist. It's a nerve that gives sensation and feeling to most of the fingers in the hand and gives strength to the thumb. It's one of the more important nerves in the body, and if it is injured or compressed in any way, it can cause quite a bit of dysfunction with the hand. I know a lot of us have been home quite a bit recently and maybe struggling with symptoms of carpal tunnel. The symptoms you're going to be looking for are numbness and tingling with the thumb to the ring finger, pain in the hand and wrist. This is specifically painful when the wrist is flexed, when you're doing repetitive use, when you're sleeping, and a lot of people will find that driving or talking on the phone can cause these symptoms to come about. Carpal tunnel syndrome is one of the more common things we see here at the SOS Hand Center. And many people can get it. There's not necessarily one specific cause of carpal tunnel, but we think it's multifactorial. It can have to do with your age, whether you're male or female. It can have to do with what you do for a living, whether it's heavy labor or repetitive work. It can be a genetic component. There's multiple different things that contribute to it, but we do know that it's very common. And if it becomes severe, it can be quite debilitating. A few things I tell people to do when they're treating carpal tunnel is first to know what position the wrist likes to make it feel better. As the nerve comes down the forearm, it goes into the wrist here. So bending of the wrist in any way, either forward or back, will compress this nerve. A lot of people, when they're typing or doing work at home, will be sitting either too far up with the wrist down or too far down with the wrist up. So it's important at home that if you have a surface that you're at, either a kitchen table or a countertop, that you put your chair in a position where you can keep your wrist as stable as possible. Sometimes it means support, and sometimes it means just moving around a little bit. That can help with keeping the nerve in a healthy, happy place. Another thing that you can do is take frequent breaks. That'll be helpful if you're doing too much repetitive use, and any inflammation in the wrist can calm down your symptoms. Stretching can be helpful. It's known that frequent stretching with bringing your wrist back and forward, doing that about 10 times every few hours, can help with stretching the nerve and the muscles around so there's not as much tension and stiffness, and help alleviate some of the symptoms. Some people advocate for anti-inflammatory medicines like ibuprofen or Aleve that can help with this a little bit. You just want to make sure you check with your primary care doctor to make sure it's okay for you to take those medications. A lot of times when people have carpal tunnel, one of the first things I'll prescribe to them is a wrist brace. Wrist brace is usually used at night, but can be used during the day. It helps stabilize the wrist so it can't bend back and forth, and allow for that nerve to again be in a more straighter position so it's not being compressed. Physical therapy is another option for carpal tunnel syndrome. If you are a candidate for this, we can refer you to professional physical therapists or occupational therapists that specialize in the treatment of compressive neuropathy or carpal tunnel syndrome. They can show you a variety of different home exercise programs that can be done to help decrease your symptoms. If you are having any of these symptoms of carpal tunnel, please give us a call here at the SOS Hand Center. It's very important not to neglect carpal tunnel. If it does increase or worsen in symptoms and is not taken care of appropriately, it can cause permanent and quite severe problems. So please give us a call if you're having any issues.